The American people expect no less. They want this bill repealed, and we're standing here today to say, American people, the President of the United States down the street at 1600 Pennsylvania Avenue may not be listening to you, but we in Congress have not forgotten you. We're listening. We're not giving up until we full square repeal this bill.
Congressional Republicans vowing to repeal the national health care, President Obama's health care, and no matter what the Supreme Court decides. So what is their next move? Representative Michele Bachmann joins us. Nice to see you.
Good to see you, Greta.
All right, now that was within seconds, that tape, of when the national health care law was passed, wasn't it?
Yeah, actually, this was just recently, this last one.
But you right after the president, right after it was signed, though, you introduced one.
I did. Actually, the night that the bill was passed on the House floor, I turned to one of my colleagues, Mike Pence, and I said, Mike, we've got to do something. We've got to enter a repeal bill. And he said, Michelle, have at it. So I called my staff. It was about midnight. We stayed up. We wrote the repeal bill that night. And the next morning, I was the first member of Congress on the floor. I introduced the full-scale repeal bill because I thought it was imperative that we let the American people know we are not waving the white flag of surrender on socialized medicine. We're going to keep fighting until it's repealed, and we will. We're not giving up.
What was the vote on that one, by the way? Do you remember?
Oh, well, it was enough. Yeah, we got killed. It was more than enough. And, of course, that's when Nancy Pelosi ran the House of Representatives, Harry Reid ran the Senate, and Barack Obama was president. So the Democrats had their way. They got their bill, and the American people hate it. They want us to get rid of it because they see that costs are going through the roof. It's the #1 reason employers aren't hiring today, and it's going to change us forever in this country. So people want us to repeal it and deal with the true cost or the true problem with health care, which is cost. This bill only increased the cost of health care. What we want to do as House Republicans is actually bring down the cost, and the good news is we can. There's positive solutions.
Well, I made a list of sort of the things that were, promised. That one of it was that the cost would go down, and 30 million who were uninsured would then have health insurance. So right now, those 30 million don't have health insurance because we haven't gotten to the mandate, right? So those 30 million still don't have
They don't have it, but here's even worse. Last week, the government, through the Congressional Budget Office, said at least 20 million people are going to lose their health care because employers drop them because the costs are escalating so fast on health care. Employers are going to let them go. So you can't win for losing on this bill.
What would you do? I mean, under your thought, would everybody have some sort of health insurance? It would just be a different program?
This is what I think we need to do. Adopt free market principles, and I put a bill together a couple of years ago that says this. #1, let any American buy any health insurance policy they want anywhere in the United States with
We can't now?
You can't. Okay. You can only buy a health insurance policy in your state, written under your state mandate.
How come?
Well, because there's this thing called the McCarran-Ferguson law at the federal level, and it creates monopolies for insurance companies in every single state. We've got to knock down those barriers and really think about the consumer and let the consumer buy any insurance policy they want anywhere in America, no minimum federal requirements, and then...
Let me ask you this.
Yeah.
So the insurance companies are making out like bandits because of this monopoly?
Well, they've got a monopoly in each state.
Okay. All right.
So what does that tell you?
That tells me a lot.
What does that tell you?
Let me
so
go
number two, what we should do is we should let every American pay for their health insurance expenses, whether it's their premiums, their copays, deductibles, pharmaceuticals, medical devices, whatever it is. They should be able to pay for it with their own tax-free money. #3, we need to have lawsuit abuse reform. If you do those 3 things, Greta, you will drive down the cost of health insurance and health costs dramatically, and that's the real problem. Because President Obama promised every household they'd save $2,500 a year. Instead, we've seen the cost spike through the roof, and that's why this is so wildly unpopular. I'm going to be in the Supreme Court to hear the oral arguments. I have a ticket. I'm going to be there to listen to it.
Well, I'll tell you what I find very troubling is that this 2,500 pages, and Leader Pelosi famously said something we have to pass it before
to know what's in it.
I think that's so people could read it and see it, but whatever. But so that the man who who argued today in the Supreme Court made some sort of sarcastic remark about how it didn't have a lot of clarity, and I thought that's the understatement. I mean, the whole thing, the bill is actually incomprehensible, but those 2,500 pages were then shipped over to HHS, and then unelected people then created these rules, this complex set of rules. All these unelected people are really running to health care.
Oh, this is a bill that will never finish being written.
But
that's why it's so terrible.
People should understand.
That's right. That's why it's so terrible. The 2,500 pages is chump change. There's already been over 10,000 pages of regulations that are written, and there's 1,200 places in the bill that you know that say the Secretary said, oh yeah, I remember the night you brought it in here, and it was
that was just the bill. That was just
the bill. And then take that times a factor of 10, and that's the beginning of the regulations. It will never end. Employers will never know if they're a criminal or not a criminal, if they're in compliance or not, and individuals will never know if we're in compliance or not. It will change us forever. It changes us forever as a people, as a country. Our relationship with government changes forever because we aren't electing a president in the future. We're electing a health care dictator who, with the stroke of a pen or with the waving of his magic wand, decides what we get today or what we don't. And the true story of health care under Obamacare is not the goodies you get, it's what government's going to take away. That's the future of Obamacare.
Well, you know,
we all lose.
I mean, the whole insanity of this is that not one member of Congress could read that thing or did read it before voting on it. I tried reading it. It was absolutely incomprehensible.
They didn't read it before they voted on it because in the Senate they didn't even get it until 3 hours before they voted on it.
It was 20. I tried to read the thing that made absolutely no sense.
And remember, the one thing that people didn't know is that it contained $105 billion, $464 million to implement. Can you imagine? Members of Congress voted for a bill that spent $105 billion, and they didn't even know that money was in there. Bizarre.
Actually,
that's why everybody should be outraged and demand that this get repealed. I don't care what the Supreme Court does. Congress has to repeal this bill. That's the bottom line.
Representative, nice to see you.
Good to see you, Greta.
Coming up, the fate of the health care